We've all experienced a stomach ache at some point. Maybe it was something we ate or a touch of the flu. But what if that pain was sharp, persistent, and centered in the lower right abdomen? What if it was accompanied by nausea, vomiting, and a low-grade fever? These could be signs of acute appendicitis, a condition that affects millions of people worldwide. The appendix, a small finger-shaped pouch connected to the large intestine, might seem like a non-essential organ. You can live a perfectly healthy life without it. However, when this tiny organ becomes inflamed or infected, it can quickly become a serious medical emergency. Acute appendicitis doesn't discriminate. It can affect anyone, regardless of age or gender. However, it is most common in people between the ages of 10 and 30. While it's a relatively common surgical emergency, early recognition and treatment are crucial to prevent potentially life-threatening complications. Imagine a ticking time bomb, small but potent, hidden within your body. That's what acute appendicitis can feel like. As the inflammation worsens, the appendix can rupture, spilling infectious material into the abdomen. This can lead to a range of complications, including peritonitis, a serious infection of the abdominal lining. Early diagnosis and treatment are essential for a positive outcome. The longer you wait, the greater the risk of the appendix rupturing, which can be life-threatening. This is why it's crucial to be aware of the symptoms and seek immediate medical attention if you suspect appendicitis. Early detection often means a simpler, less invasive surgery and a faster recovery time. Conversely, delaying treatment can lead to a more complex surgery, a longer hospital stay, and a higher risk of complications. Understanding the signs and symptoms of acute appendicitis is the first line of defense. While the classic symptom is a sharp pain that begins near the belly button and migrates to the lower right abdomen, not everyone experiences the same sequence of events. Some people may experience nausea, vomiting, loss of appetite, low-grade fever, constipation or diarrhea, and a general feeling of malaise. It's important to remember that these symptoms can mimic other conditions, making it even more crucial to consult a healthcare professional for an accurate diagnosis. In the next section, we'll delve deeper into the early symptoms of acute appendicitis and how they compare to other common ailments. We'll equip you with the knowledge to recognize the warning signs and seek timely medical attention, potentially saving yourself or a loved one from a potentially dangerous situation. Imagine waking up with a dull ache around your belly button. It's not excruciating, but noticeable. You might dismiss it as indigestion, but the pain shifts to your lower right abdomen. This is a hallmark sign of acute appendicitis. The pain worsens with movement or deep breaths. Loss of appetite is common. Food might make you feel nauseous. These changes are your body's alarm. The appendix's location can vary. Pain might manifest differently. For some, it's more centralized. Pregnant women might feel it higher. One of the biggest challenges in diagnosing acute appendicitis is its similarity to other common conditions. Gastroenteritis or stomach flu, for instance, can present with abdominal pain, nausea, and vomiting, much like early appendicitis. However, there are subtle distinctions. In gastroenteritis, the pain is often crampy and diffuse, affecting a larger area of the abdomen. It's often accompanied by diarrhea, which is less common in early appendicitis. Similarly, conditions like kidney stones or urinary tract infections can cause pain that radiates towards the lower abdomen, mimicking appendicitis pain. Another tricky mimic is mesenteric adenitis, an inflammation of lymph nodes in the abdomen, common in children. It can cause pain similar to appendicitis, often accompanied by fever and loss of appetite. This highlights why a proper medical evaluation is crucial to differentiate appendicitis from these other conditions. While abdominal pain is the most prominent symptom, acute appendicitis often presents with a constellation of other signs. These additional clues, though subtle, can provide valuable information for a healthcare professional. Fever is a common accompaniment to the abdominal pain, usually low-grade in the early stages. This rise in body temperature is a natural response to the inflammation brewing in your appendix. You might also experience changes in your bowel habits, such as constipation or diarrhea. A general feeling of malaise, fatigue, and the inability to get comfortable are other telltale signs. In some cases, you might notice blood in your stool or urine. This is a red flag and warrants immediate medical attention. It's important to note that the absence of these additional symptoms doesn't rule out appendicitis. Every individual is different, and the presentation of symptoms can vary widely. Many people, fearing an unnecessary trip to the hospital, often adopt a wait-and-see approach when experiencing abdominal pain. While this approach might be appropriate for minor digestive issues, it could be life-threatening when it comes to acute appendicitis. If you experience sudden severe abdominal pain, especially if it's localized to the lower right side and progressively worsens, seek immediate medical attention. Don't ignore the accompanying symptoms like fever, nausea, vomiting, or changes in bowel habits. Remember, delaying treatment for acute appendicitis can have serious consequences. The next section will delve into the progression of this condition and the potential complications that can arise if left untreated. Remember that initial ache near your belly button? As acute appendicitis progresses, that once tolerable discomfort can morph into a sharp, persistent pain that settles in the lower right abdomen. Imagine a dull throbbing that intensifies with every step you take, every bump in the road, even every deep breath. This agonizing pain isn't something you can simply walk off or ignore. It demands your attention, signaling that something is seriously wrong. The pain might radiate to your back or groin, making it difficult to find a comfortable position. Simple movements like walking, coughing, or even laughing can become excruciating. The severity of the pain, however, isn't always an indicator of the severity of the appendicitis. Some individuals may experience rapid escalation of pain, while others may have a more gradual increase. Don't be fooled by a temporary lull in pain, as this could be a sign of a rupture, a dangerous complication we'll discuss later. As the inflammation in your appendix rages on, your body's natural defense system kicks into high gear. Fever, a common symptom of infection and inflammation, often accompanies the escalating pain of acute appendicitis. Think of it as your internal alarm system, signaling that something is amiss. While a low-grade fever might have accompanied the initial symptoms, it typically climbs higher as appendicitis progresses. You might feel hot to the touch, especially in the abdominal area. Chills, sweating, and a general feeling of achiness are also common as your body fights the inflammation. It's important to note that fever alone isn't a definitive sign of appendicitis. Many conditions, from the common cold to more serious infections, can cause a rise in body temperature. However, when coupled with severe localized abdominal pain and other gastrointestinal symptoms, fever becomes a crucial piece of the diagnostic puzzle. Acute appendicitis doesn't just wreak havoc on your abdomen, it can also send your digestive system into a tailspin. Nausea, that queasy feeling that often precedes vomiting, is a frequent companion to the pain and fever. The mere thought of food might make your stomach churn. Vomiting, while not present in all cases, is another common symptom, especially as the condition worsens. You might experience several bouts of vomiting, which can lead to dehydration if left unaddressed. Changes in bowel habits, such as constipation or diarrhea, can also occur. These gastrointestinal symptoms arise for several reasons. The inflammation in your appendix can irritate your bowels, leading to nausea and vomiting. Additionally, the swelling can obstruct the passage of food and waste through your digestive tract, contributing to constipation. Diarrhea, though less common, can occur if your body tries to flush out the inflammation. Section 4. The telltale signs. Recognizing a potential emergency. Recognize these red flags: sudden relief from pain, increased pain with movement, inability to pass gas, rapid heart rate, and confusion. These symptoms could indicate a serious condition requiring immediate medical attention. Section 5. A race against time. Why prompt action is crucial. Acute appendicitis is not a condition to be taken lightly. It's a race against time. where early detection and prompt medical intervention can mean the difference between a relatively simple procedure and a life-threatening situation. Delaying treatment increases the risk of the appendix rupturing, a serious complication that can lead to peritonitis, a life-threatening infection of the abdominal lining. When the appendix ruptures, it spills infectious material into the abdominal cavity, potentially leading to sepsis, a systemic inflammatory response that can be fatal. Remember, if you suspect appendicitis, don't hesitate to seek medical attention. It's always better to err on the side of caution. The next section will delve into the diagnostic procedures used to confirm appendicitis and the importance of timely intervention. Section 1. The Diagnostic Journey. Unraveling the Mystery Within. Suspecting appendicitis is like a detective's quest, searching for clues within the body. The journey starts with a medical history and physical exam, gathering information and observing signs. You describe the pain moving to the lower right abdomen, nausea, and fever. The doctor listens intently, asking about your symptoms. Next comes the physical exam. The doctor palpates your abdomen, feeling for tenderness or rigidity. Section 2. Beyond the Touch. The Role of Blood Tests. While the physical exam provides valuable clues, it's not always enough to confirm a diagnosis of appendicitis. That's where blood tests come into play. These tests offer a glimpse into the inner workings of your body, revealing telltale signs of infection and inflammation. One of the key blood tests ordered is a complete blood count, or CBC, which measures the different types of cells in your blood. In acute appendicitis, the white blood cell count is often elevated, a sign that your body is fighting off an infection. This elevation, however, is not exclusive to appendicitis and can occur with other inflammatory conditions. Another important blood test is the C-reactive protein test. CRP is a protein produced by the liver in response to inflammation. Elevated CRP levels, along with the clinical picture and other test results, further strengthen the suspicion of appendicitis. Section 3. Imaging the invisible. Peering inside with ultrasound and CT scans. Sometimes, the clues gathered through the medical history, physical exam, and blood tests are not conclusive enough to confirm or rule out appendicitis. In these cases, imaging tests like ultrasound and CT scans become invaluable tools, allowing doctors to visualize the appendix and surrounding structures. Imagine an ultrasound as a sonar system for your body. A small handheld device called a transducer emits sound waves that bounce off your organs, creating images on a screen. An ultrasound can often visualize an inflamed appendix, which might appear enlarged, thick-walled, or surrounded by fluid. If the ultrasound is inconclusive, a CT scan might be ordered. This imaging test uses X-rays to create detailed cross-sectional images of your abdomen. A CT scan can often detect an inflamed appendix with a high degree of accuracy, even in cases where the ultrasound is inconclusive. Section 4. The Importance of a Precise Diagnosis, Ruling Out Other Suspects. Diagnosing acute appendicitis is like solving a complex puzzle where each piece of information, each test result, contributes to the overall picture. It's not always a straightforward process, as other conditions can mimic the symptoms of appendicitis, leading to potential misdiagnosis. Conditions like gastroenteritis, kidney stones, urinary tract infections, pelvic inflammatory disease, and even ectopic pregnancy can cause abdominal pain, nausea, and vomiting, making it crucial to rule out these suspects before confirming appendicitis. This is why a thorough medical history, a comprehensive physical exam, and appropriate diagnostic tests are essential. A misdiagnosis can lead to unnecessary surgery or, conversely, a delay in treatment for the actual underlying condition. The diagnostic journey in suspected appendicitis is not merely about identifying the culprit, it's a race against time. The sooner the diagnosis is confirmed, the sooner treatment can begin, minimizing the risk of serious complications. Prompt diagnosis allows for timely surgical intervention, which is the gold standard treatment for acute appendicitis. Early appendectomy, the surgical removal of the appendix, is associated with a lower risk of complications, shorter hospital stays, and faster recovery times. Conversely, delaying diagnosis and treatment increases the risk of the appendix rupturing, a serious complication that can lead to peritonitis, sepsis, and even death. The longer the delay, the higher the stakes, making early diagnosis paramount in the management of this potentially life-threatening condition. We've talked about the signs of acute appendicitis and the importance of prompt medical attention. But what happens when this ticking time bomb explodes? Delaying treatment can lead to a ruptured appendix. Infectious material spills into the peritoneal cavity, leading to peritonitis, a serious complication. Picture your abdomen as a battlefield. On one side, you have the invading bacteria, released from the ruptured appendix, multiplying rapidly and wreaking havoc. On the other side, you have your body's valiant immune system, deploying white blood cells like soldiers to fight off the infection. Peritonitis, the inflammation of the peritoneum, the thin membrane that lines your abdominal cavity, is a serious and potentially life-threatening complication of a ruptured appendix. As the infection spreads, it triggers a cascade of inflammatory responses, leading to a range of debilitating symptoms. Imagine a pain so intense it takes your breath away, a pain that intensifies with the slightest movement. Imagine a fever that soars, chills that rack your body, and nausea that leaves you unable to keep anything down. These are just some of the harrowing hallmarks of peritonitis. A ruptured appendix can lead to a life-threatening condition known as sepsis. Sepsis causes widespread inflammation and organ damage. It's like a conductor gone rogue, leading to dysfunction. Immediate treatment is crucial. Every minute counts. Let me introduce you to Sarah, a vibrant 25-year-old woman who brushed off her initial symptoms of abdominal pain and nausea, attributing them to a stomach bug. She popped some over-the-counter antacids, hoping for relief. As the hours turned into days, Sarah's pain intensified, but she hesitated to seek medical attention, fearing an unnecessary trip to the hospital. By the time Sarah arrived at the emergency room, her appendix had ruptured, unleashing a torrent of infection into her abdomen. She was diagnosed with peritonitis and immediately prepped for emergency surgery. Despite the medical team's best efforts, the infection had spread, triggering sepsis. Sarah spent weeks in the intensive care unit battling for her life. Sarah's story, though fictional, is a stark reminder of the potential consequences of delaying treatment for acute appendicitis. It highlights the importance of recognizing the warning signs, seeking timely medical attention, and understanding that early intervention can be life-saving. We've journeyed through the intricacies of acute appendicitis, from the subtle whispers of its early symptoms to the potential devastation of a ruptured appendix and its complications. We've explored the diagnostic odyssey, emphasizing the crucial role of a thorough medical history, physical exam, and imaging studies in unraveling this medical mystery. But the most critical takeaway from our exploration is this: time is of the essence. Acute appendicitis is not a condition that waits for convenience or tolerates procrastination. It demands swift, decisive action. Early diagnosis and treatment are paramount in preventing the potentially life-threatening complications of a ruptured appendix. Remember Sarah, the young woman whose story we heard earlier? Her experience serves as a stark reminder that ignoring the warning signs, downplaying the severity of symptoms, or delaying medical attention can have dire consequences. Acute appendicitis is a race against time, and early intervention is often the key to a positive outcome. Our bodies are remarkable machines equipped with intricate systems that work tirelessly to keep us healthy. But just like any well-oiled machine, our bodies can malfunction, sending out distress signals when something is amiss. Acute appendicitis is one such signal, a cry for help that should never be ignored. If you or someone you love experiences the telltale signs of appendicitis, the migrating abdominal pain, the nausea, the fever, don't hesitate to seek medical attention. Don't let fear, denial, or misinformation delay potentially life-saving treatment. Remember, it's always better to err on the side of caution. Trust your instincts, listen to your body's whispers, and seek timely medical care. By doing so, you empower yourself with knowledge, equip yourself with the best chance of a positive outcome, and potentially save yourself or a loved one from a perilous medical journey. Remember, in the realm of acute appendicitis, a stitch in time truly saves 9.